What are the signs and symptoms of breast cancer? Why is it so important to check your breasts, and how often should you perform breast self-examinations? What should I do if I find a lump? Will every lump be cancer? I'm Salena Bains, a consultant oncoplastic breast surgeon at the Priory Hospital, part of Circle Health Group, the largest private healthcare provider in the UK. Today, I'll be answering some of your most frequently asked questions about breast cancer, signs and symptoms, checking your breasts for changes, and what to do if you notice something different. Breast cancer is the second most common cancer worldwide and the most common cancer amongst women. It is extremely important to understand the signs and symptoms of breast cancer so that you can detect it early. The earlier you detect cancer, the sooner you can start treatment and the higher your chances of getting better. And one of the most important tools for spotting breast cancer early is to look for changes in your breasts using a self-examination. So I'm going to show you how. Why is it important to perform breast self-examinations? Breast self-examinations are a vital tool for the early detection of breast cancer. By examining your breasts regularly, you become familiar with their normal look and feel. This familiarity helps you to quickly identify any changes in your breasts. Once you find changes, you can visit your doctor so that they can perform a further examination of the symptoms you have found. In many cases, a change in your breast is not a sign of cancer. It can be a number of things. For example, you might have found a benign cyst, or you may have just noticed variations in breast tissue that can change depending on where you are in your cycle. However, changes in your breast are among the early signs of breast cancer, so it's crucial to get them checked out. How often should I perform breast self-examinations? It's recommended that you perform breast self-examinations once a month. Choose a consistent time in your menstrual cycle so that you can understand how your breasts change throughout your cycle. If you have been through menopause, stick to the same date each month for consistency. If you want to check your breasts more regularly, you can, but your breasts can change significantly over the course of your menstrual cycle, so we find once a month at the same time each month is the most effective. What is the best time during my menstrual cycle to perform a breast self-examination? If you have periods, it's generally best to perform breast self-examinations a few days after your period ends. During this time, your hormonal fluctuations are minimal, reducing breast tenderness and swelling that might interfere with the examination. Swelling can prevent you from feeling lumps properly, and also it can be sore to press your breasts when they are swollen and sensitive to the touch, which many people experience during their period. How do I check my breasts for changes? Follow these steps for a thorough self-examination. Stand in front of a mirror with your arms at your sides. Look for changes in size, shape, or skin texture. Raise your arms and examine your breasts again. Look for any signs of fluid discharge from the nipples. Lie down and use your opposite hand to feel your breast in circular motions. Cover the entire breast and armpit area. Stand or sit up and repeat the circular motions again using varying levels of pressure. What am I looking for during a self-examination? During your self-examination, there are several signs and symptoms which you should be on the lookout for. These include new lumps or masses in either your breast or your armpit, any thickening or swelling in part of your breast, changes in the size of the breast or the shape of the breast, skin changes such as dimpling, redness or scaling, nipple changes including discharge or indrawing of the nipple or any changes in the colour of your nipples, pain or discomfort in your breast without obvious cause. What should I do if I find a lump or notice a change? When you self-examine your breasts, if you find a lump or notice any changes, don't panic. Most breast lumps are benign, but it's vital that you consult a healthcare professional. For example, you could contact your GP, or you could visit one of our breast clinics where you will see a breast specialist quickly. There, you'll be given a professional evaluation and, if necessary, sent for further tests such as a mammogram or an ultrasound scan. These can help determine whether a lump is benign. Your doctor might also arrange for you to have a biopsy. During this, your doctor will take a small piece of tissue, also known as a biopsy, to be looked at under a microscope. The tissue will be examined for unusual cells that could indicate cancer. You might experience some discomfort and swelling after having the biopsy, but the process isn't usually painful as they use local anaesthetic. Can breast self-examination replace regular mammograms? No. Breast self-examinations are meant to be performed in addition to regular mammograms and clinical examinations, and not as a replacement. Mammograms are more sensitive, and so they can detect smaller abnormalities that might not be noticeable during a self-examination. What if I have a family history of breast cancer? If you have a family history of breast cancer, it's advised to be vigilant about your breast health. Get yourself checked regularly, as well as performing your monthly checks at home. Speak with your GP or another healthcare professional to determine if additional screenings or genetic testing is recommended. Always remember to self-check your breasts and be aware of the signs and symptoms of breast cancer. Is there a specific age to start performing breast self-examinations? It's a good idea to become familiar with your breast health early on. While there's no specific age to start, I would recommend that you begin performing self-examinations in your late teens or early 20s. How can I reduce my risk of developing breast cancer? While there is no guaranteed way to prevent breast cancer, you can lower your risk by maintaining a healthy lifestyle. This includes taking regular exercise, maintaining a healthy weight, limiting alcohol consumption, and avoiding tobacco. This doesn't mean that people who are generally healthy cannot get breast cancer. Often there is nothing you could have done to prevent the development of cancer. What are the different types of breast lumps? There are several types of breast lumps which can be broadly categorised as benign or non-cancerous, or malignant, also known as cancerous. Benign lumps include cysts, fibroadenomas, and adenosis. Malignant lumps are cancerous. Examples of these would be invasive ductal carcinoma and invasive lobular carcinoma. It is useful to understand about the different types of breast lumps so that you can be aware that there are many causes of lumps in your breasts. And it's always important to have a doctor examine the lump and help determine its cause so that you can get the right treatment. A breast cyst is a benign breast lump. It is a fluid-filled sac that often feels smooth and movable. It may be tender and fluctuate in size with your menstrual cycle. Cysts may not require treatment unless they cause discomfort. A cyst can feel small and pea-sized, or sometimes be slightly larger, comparable to a coin or a marble. Fibroadenomas are common benign breast lumps that consist of glandular and fibrous tissue. They typically feel firm, smooth, and rubbery. While fibroadenomas are usually harmless, they can be removed if they cause discomfort or concern. You can usually use your fingers to move this type of lump around your breast. Some people even find it can move on its own and therefore be difficult to find when examining their breasts. How can I differentiate between a benign and malignant lump? While it's not always possible to determine the nature of a lump based solely on how it feels, certain characteristics such as mobility, smoothness, and changes over the menstrual cycle are often associated with benign lumps. Malignant lumps may feel irregular, firm, and may not move freely. However, it's important to note that not all breast cancer lumps follow the same characteristics. You can't know for certain, so you have to have a scan or biopsy to fully understand the cause of your lump and the type of treatment you need for it, if you need treatment at all. How are breast lumps diagnosed? Breast lumps are typically diagnosed through a combination of clinical breast examinations and imaging tests. This includes mammograms, ultrasound scans, or MRIs, and in some cases, biopsies. As I mentioned before, biopsies involve removing a sample of tissue for examination under a microscope to determine if it's benign or cancerous. Can breast lumps change over time? Yes, breast lumps can change over time. Some lumps, such as cysts, may fluctuate in size based on hormonal changes. However, any new or persistent changes in breast tissue should be evaluated by a doctor. In some cases, breast lumps are completely hormonal and come and go depending on where you are in your cycle. Are most breast lumps cancerous? No, the majority of breast lumps are benign. However, it's crucial to have any new or unusual lumps evaluated by your doctor to rule out the possibility of breast cancer. As mentioned before, the sooner you find a lump, the sooner you can discover its cause and get treatment if needed. Are breast lumps common during pregnancy and breastfeeding? Yes. Hormonal changes during pregnancy and breastfeeding can lead to the development of benign breast lumps such as cysts. However, any new lump should be evaluated by a healthcare provider. If you find a lump in your breast when doing your self-examination, don't panic. The best thing to do is to contact your doctor and to go from there. If you want to come and see me for a consultation to discuss a lump in your breast and have an examination, then you can book online via the link in the description below. or alternatively, search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.